meu nome é Joana Assunção, sou assistente social, mas também par. Vivo com VIH e identifico-me como uma pessoa que usa drogas.
O meu nome é João de Santa Maria, usei drogas injetadas durante 13 anos e provavelmente foi esta minha experiência que foi o que motivou o eu estar a trabalhar aqui neste momento.
Eu sou Maria do Rosário, eu fui utente cá. Isto tudo leva um percurso, porque na altura eu era consumidora de heroína e cocaína, fumada, e era trabalhadora sexual. Em 2016, inicio o meu tratamento com a ajuda de um par aqui do Moraria. Há 5 anos que sou par no GAT.
My name is João. I've been working for GAT since 2021 and I'm the focal point for harm reduction and chemsex users.
I'm Luís. I work in Checkpoint since 2016. I live with HIV. It's 20 years already. And I think I was chosen to work in GAT also because of that.
For me, it's really important to know that I'm contributing to the health of my community. Community-based centers are as good and as efficient as health services with doctors and nurses. Peer work is really important for us, and it really works because people come back. So I don't want to brag, but we have an excellent service.
Welcome to GAT, and specifically to GAT Checkpoint LX. We wanted to do only policy, advocacy, and change the world. And then suddenly we realized that we needed something for MSM. Here we started the rapid testing, but we evolved to other things.
Rapid tests, HIV, syphilis, hepatitis B and C, and nurse appointments, and medical appointments as well. And also we refer to PrEP in the hospitals. We refer to HIV treatment, hepatitis treatment.
We have 5 rooms that are all equipped for rapid testing. 2 of them are more tailored to other services, for nursing, for example, and doctor's appointments. They have all the material and also informational material for other support groups, other services. We have needles and syringes and other things that are needed for harm reduction during injections, consumption, and also for smoked consumption. So yes, this is one of the counseling rooms and testing rooms. As you can see, all of them are more or less equipped the same. The pamphlets with the information, condoms and lubricant. How to have access to Mpox information, it's just a QR scan. We were one of the first centers to start vaccinating people against Mpox here in Portugal. And people just can lay down to get their antibiotic injection for chlamydia and gonorrhea, because we offer that treatment.
GAT has several testing sites, okay, and they are all adapted more or less for key populations. So all the sites are open to everyone, but they are built and offering the services more tailored to key populations.
Here, most of the team, I would say all of the team, sorry, it's MSM. But when you go to GAT Intendent, as Mariana has mentioned, because they are serving trans people, sex workers, and also Latin American migrants, you can find also peers coming from all these communities. And we have also trans peers working there. GAT performs 100,000 tests per year, which I think it's a lot. We would like to perform the double, because we want to end the pandemic. This is our goal.
You must be doing something really well, because since 2010 you have decreased HIV new infections in 65%, so minus 65%, and minus 71% on HIV-related deaths. So thank you for that work.
Os pares, como o nome indica, são pessoas que partilham algo em comum neste caso, as pessoas que apoiamos, seja porque vivem com a infecção, seja porque pertencem a algum grupo dos grupos que apoiamos. Pode ser um par que seja um homem que tem sexo com homens, uma pessoa que usa drogas, como eu, um migrante, um trabalhador sexual, inseridos na comunidade E, portanto, muitas vezes são os pares que trazem as pessoas para a intervenção e conseguem também ser o elo de ligação entre as pessoas e os diferentes serviços.
The main issue is we are all peers because we are all men who have sex with men. So more or less we can understand what the people are facing every day. For example, for someone that lives with HIV, how can I tell to my boyfriend or to my girlfriend that I have HIV?
Working with peers totally contributes to reducing stigma and reducing the downfall of having one of these diagnoses or having one of these habits. It really breaks down and it really kind of normalizes living with HIV. It normalizes having hepatitis C or any of other infections. It kind of broadens the horizon to deal with these situations without being very worried about it as well. And I think that the work that we do kind of multiplies in different areas because they will know how to say to other people that they live with this diagnosis or with whatever situation. So it kind of flourishes different dialogues. So I think that's why peer work is so extraordinary.
And the results are there. We have the organization that tests more people in Portugal. The Portuguese state is counting on these numbers. They count with GAT and other organizations in Portugal to do the rapid tests, to have these community-based centers.
Welcome to GAT in Moraria. This is our drop-in center. We are here for 11 years now. This neighborhood, Moraria, is a neighborhood that is characterized by the presence of people who use drugs in the streets, many people who experience homelessness, a lot of street sex work, and also migrant communities. In this space, an average 70 to 80 people enter every day. You can come here and you can ask for safe injection and smoking material. Also, we have condoms and lubricants, and people can just chill in this couch, can go to the internet, they can charge their phones also. Many people receive their mail here, which is a very important service here. And there's always, if the person wants, some peer counseling. In all GAT services, we provide the fast testing for HIV, hepatitis, and syphilis. We also have the decentralized appointments for hepatitis C. Any person can do the treatment from the beginning until the end here in the community. Some people came here every day just to take their pills because it's in a safe space. The community intervention here, the drop-in space, the outreach team, and also the safe consumption space is led by peers. People come here, they knock on this door to have access to a space, a safe space to use drugs, managed and led by our peers, João, Rosário, and Jacinto. We created this space because people were smoking and injecting in the streets. Together, we designed and painted this graffiti with some very important messages from our community.
Here is the consumption room for injection. You can come in. We built this place because of an European project. It was a project on education for safer consumption. We had these 3 places here, 2 there, and the original idea was that this was the nurse office. Now it's also for consumption. And what we realized that sometimes, for example, for women wanting to inject drugs, sometimes it's not comfortable to be in the same space, and because sometimes they want to inject in other parts of the body that it's more intimate, they can go there and close the door and they are more comfortable. But there's always, so the peers, they manage this space, but of course there's always a nurse here at the same time if she needs to provide care to someone.
The numbers every month are rising, so per month 300 injection episodes. and in the smoking part 1,000 more or less. Until today we have registered here 12 overdose situations where we had to intervene. All the staff is trained. We had only, for example, to call the ambulance like 3 times, and actually when the ambulance got here, we already took care of the situation. The community also wants to define the rules and how the service works, so we have to be very attentive about that. Violence is not accepted here, racism and violence against women.
When In Moraria opened, we thought we would get mostly injectors, but it was not the case. So we had a lot of people using crack. So what the colleagues did, they implemented a pilot to see what kind of pipe they would prefer to use.
Rosario, our peer, she's the one who usually leads also the injection part, and the injection spot is a very intimate space. We have a curtain here, and people, while they are preparing the substance and injecting, they are sharing so many things, and it's a very special moment of the day. And then the peers and the harm reduction workers who do the community intervention are the ones who sometimes take people if they want to. They make the bridge with the social worker, the nurses or the doctors. Thanks to our peers also, again. We are here for 10, almost 11 years. So there's a very good relationship that has been built all over these years. For example, our older lady neighbors, they like to come here to ask the doctor the prescription or to check the blood pressure. So it's like an exchange.
A importância dos pais é esta experiência que os pais têm da sua vida de consumo, não é? Que depois, juntamente com as experiências dos técnicos, poderá fazer uma super intervenção.
Ontem, por exemplo, o que mais me enche o peito é um utente partilhar comigo, chorar comigo, desabafar comigo. E ontem, um utente nepalês que fala muito pouco português, mas percebe, e nós, ao falarmos, ele começa a chorar e a dizer que precisava de ajuda, help me. E eu abracei-o e disse: nós estamos cá para te ajudar naquilo que for preciso. Acho que é isso que me enche mais o peito, é os utentes sentirem que podem contar com a gente para os ajudar.